How does non-seminoma testicular cancer differ? How does non-seminoma testicular cancer differ from other types? This question is essential for understanding testicular cancer and its various forms. Non-seminoma testicular cancer is one of the two main types of germ cell tumors, the other being seminoma. The key differences lie in their cellular composition, growth patterns, typical patient demographics, and treatment responses. Non-seminomas arise from germ cells that are more immature and differentiated than those found in seminomas. They often consist of a mix of different cell types, including embryonal carcinoma, yolk sac tumor, choriocarcinoma, and teratoma. This mixture can appear in various combinations within a single tumor. In contrast, seminomas are more uniform in cell type and generally grow and spread more slowly. Age plays a significant role in the occurrence of non-seminoma testicular cancers. These cancers typically affect younger men, often between their late teens and early 30s. Both seminomas and non-seminomas account for about 98% of all testicular germ cell tumors and occur at similar rates. When it comes to clinical and biological features, non-seminomas tend to grow more rapidly and are more likely to spread outside the testicle earlier than seminomas. They often produce elevated levels of tumor markers like alpha-fetoprotein and human chorionic gonadotropin. These markers are crucial for diagnosis and monitoring treatment response. While seminomas may produce human chorionic gonadotropin, they do not produce alpha-fetoprotein. Symptoms of non-seminomas can include a painless lump or swelling in the testicle, a feeling of heaviness in the scrotum, and sometimes discomfort or pain. If the disease advances, it may cause symptoms related to metastases. In terms of histology and subtypes, non-seminomas include several aggressive forms. Embryonal carcinoma cells resemble early embryonic tissue and tend to spread quickly. Yolk sac tumors mimic the yolk sac of an embryo and are common in children but can also occur in adults. Choriocarcinoma is a rare but highly aggressive subtype that often spreads early. Teratomas can contain mature or immature tissues resembling various body parts. Mature teratomas rarely spread but can recur. Treatment for non-seminomas typically involves surgical removal of the affected testicle, known as orchiectomy, followed by chemotherapy and sometimes lymph node dissection. Non-seminomas generally respond well to chemotherapy, especially when detected early. However, due to their tendency to spread earlier, they usually requiring more aggressive treatment than seminomas. The overall prognosis for non-seminoma testicular cancer is positive with appropriate treatment, but it heavily depends on the stage at diagnosis and the levels of tumor markers. In summary, non-seminoma testicular cancer differs from seminoma mainly through its mixed and more immature cell types, earlier and more aggressive spread, typical occurrence in younger men, distinct tumor marker profiles, and treatment approach. Understanding these differences is crucial for effective diagnosis and management of testicular cancer within the broader context of reproductive cancers. Always consult healthcare professionals for personalized medical advice.